welcome back to Simply Women's Health with CJ. Today we're going to talk about the 6th month of pregnancy, focusing on weeks 24 to 28. At 24 weeks, your baby is probably moving all the time. 24-weekers are notoriously active. You are going to have the occasional cramp, you're going to have the occasional twinge, you're going to have the occasional spot or two of blood after sex. Round ligament pain, stretching pains that occur down deep in your pelvis. Every time you sneeze, laugh, cough, roll over in bed, bend over to pick something off the floor, you can get a pulling sensation down deep in your pelvis that can take your breath away. It's perfectly normal. What's not okay at this point? Bright red bleeding that's enough to saturate a pad. It's not okay for you to have water running down your legs that isn't pee. If you have not already sneezed and tinkled, it's probably just a matter of time. It's not okay for your baby to not move, and it's not okay for you to have 5 or more cramps in 1 hour. If these are symptoms that you are experiencing, I recommend you make an appointment with your provider for evaluation. When you come in for your 24-week visit, your provider is going to want to get your weight. At this point, we anticipate about a half a pound to a pound a week of weight gain. They're going to want to get your blood pressure. They're going to want to listen to your baby with the fetal Doppler. They're going to want to talk to you about upcoming lab work. Between 24 and 28 weeks, they will want to order what's called a glucose tolerance test. That is a test to see if you are a diabetic that is specific to pregnancy. A lot of providers will also order a CBC at this point to make sure that you're not anemic. You're also going to want to answer any questions that you might have. Now is a good time for you to start keeping a journal and writing down those questions as you think of them so that when you go to your appointment, you can remember what you wanted to ask. Now is a good time for you to start preparing to be a mom. You're going to want to start interviewing pediatricians. You're going to want to start thinking about how are you going to feed your baby. If you're planning on breastfeeding, I highly recommend you sign up for a breastfeeding class, especially if this is a first baby. Birth plans. What do you want your delivery to look like? I do recommend prenatal classes if they are available to you as well. If there's a daddy boot camp that your husband or your partner can sign up for, again, I recommend that as well. If you're planning on using a doula, now's a good time to interview doulas. If you are employed, now is probably also a really good time for you to talk to your employer about what your company's maternity leave policy is. And finally, start looking for childcare. In a lot of places, childcare is at a premium, and now's a good time for you to start looking around and maybe even getting yourself on some wait lists. Most of all, this is the point in pregnancy where I say sit back and enjoy. All of those early pregnancy hormones they should be a thing of the past. Most women at this point are feeling a lot better. You're feeling the baby moving on the regular basis, which will provide some reassurance. And you're not big and bulky yet. So again, enjoy. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.